Hello, welcome to the My Health Journal Train the Trainer session number 1. I'm Ava Crawford, the Women's Health Program Manager with the North Carolina Healthy Start Foundation. The foundation is dedicated to reducing infant deaths and improving the health of women and children across the state. This first webisode will focus on training you on how to guide women on how to better monitor and manage their health better and to set personal health goals. Let's get started with this My Health Journal training session. Okay, what I'd like to do is give you your own copy of the Health Journal. And this is what you will do with the ladies that you work with. Make sure they have their own personal health journal. My Health Journal is a self-help interactive booklet that provides health information and allows women to personalize it. My Health Journal even has a place where women can set simple personal health goals and a plan of action for living a healthier lifestyle. By the end of this training, you will be able to explain the purpose and the components of the My Health Journal. Identify ways to use it, understand your role as a health journal presenter, help understand the importance and need for keeping a health journal, integrate My Health Journal concepts into existing programs and services, expand collaborative partnerships. The journal is separated into 8 key areas for easy reference. The key areas include resources and contacts, checkup challenge, general health history, reproductive health, emotional health, family health history, healthy living, and important papers. You can easily choose one section at a time to review and discuss with your audience. If you and your organization are providing programs and services for women of childbearing age, and you want to help them get started, you can order the My Health Journal from the North Carolina Healthy Start Foundation for free at www.nchealthystart.org. Click on Catalog, allow 2 to 3 weeks for delivery. Remember, they are available in English and Spanish. For more information in Spanish, go to www.mamasana.org. Encourage the women to have a plan for their health. Remind them that they have the power in their hands to have good health practices. Their healthcare team and other resources like those provided by North Carolina Healthy Start Foundation can educate and support them in their efforts to be healthy. Oftentimes, we hear women talk about how busy their lifestyle is. This is your opportunity to get the conversation started. Use this opportunity to get women thinking and discussing and planning about their health. Ask the question, what's their plan? What's their plan for their future? What's their plan for their healthy lifestyle? What's their plan for their health in general? The My Health Journal can help you guide those conversations and get them started. The conversation could be conducted with women one-on-one in a small group or a large group conference setting. This all depends on the type of services you provide. While with your group, you might start by saying, if you're not healthy and not feeling well, things naturally become disconnected. Give yourself the okay to stop and take care of yourself and put your health first.
I actually tell the women, you can be Superwoman, but you can't be Superwoman when you're sick. So it's important that you take care of yourself as well as them so that you can be at your soccer games and your football games or your cheerleading competitions. So then they love that. So
the example I always use, I said, have you ever been in an airplane flying and the flight attendant would say, in the event that the oxygen mask drop, please put it on yourself first before you can help someone else. So I use that as an example because I'm saying you got to help you so that you can be able to help someone else.
My Health Journal was created because so many women told us, I have so many things on my plate. I need something to help me get started, to stay on track, and to monitor my health status better. How often have we heard things like this? A lot on their plate means a lot to remember and keep up with. Encourage women to keep it simple. Keep a personal health journal which lists their checkups, screenings and test results, questions for doctors, and their guidance and suggestions.
You're here for a basic checkup?
Yes.
Oh, okay, awesome.
Motivate them to think ahead and plan before they go to their next medical visit.
I ask them to bring their journals in, have their information, questions that they've been wondering about, changes that they've noticed themselves, so that they're prepared to give this information to the provider.
This can kind of be used somewhat like an organizer. They can keep this in their purse because it's pretty durable, and they can go ahead and just take this to the doctor and document everything that they have on there, because in the slots they have the dates, they have the reasons why, it has the questions that that person wants to know from their physician.
We hope after hearing this information that you'll go a step further. Challenge yourself. Take time and think about how you can incorporate this into your programs and services. Take a moment and think out of the box. Do you and your organization serve women of childbearing age? Do you provide services for infants and children where you will also see the mothers and women of those children? Whether your resources are health related or not, do you have a captive audience through your programs and services? The concept is to motivate women in the community from all walks of life to take action and make a commitment to a healthier lifestyle. Here are some ways you can do this. One-on-one home visits after mom has a baby or other reasons. Small group, such as workshops, seminars, Bible study groups, women's groups, teen groups, book clubs, or health education classes. Consider conducting classes at clinics, food bank sites, job link sites, women's shelters, or at worksite wellness events. Not one person or organization can do it alone. It takes people and organizations coming together, sharing their resources, sharing their services, so they can reach women better. How can you find what you need and stay connected? Try Riches. The North Carolina Healthy Start Foundation, with funding from the North Carolina GlaxoSmithKline Foundation, coordinates a project called Resources in Communities Helps Encourage Solutions, or Riches. Riches is a network of organizations and agencies across the state where folks like you can connect with one another, share resources, and increase collaborative partnerships. Want more information? Contact Riches at nchealthystart.org or visit our website at www.nchealthystart.org and Riches webpage. Thank you for taking time to participate in this webisode. Webisode 2 will take the time to explain the importance of women knowing their family health history and keeping up with the recommended health checkups and screenings. We encourage you to join us, the North Carolina Healthy Start Foundation, to begin your efforts to plan and integrate the My Health Journal concept in your organization. This resource will help you empower women to be confident, better equipped to make informed decisions about their health, to plan, to prepare, track, and monitor their health status much better. It will also help you expand your current programs and services and collaborative partnerships. Remember, healthy women build healthy communities.
Information in this webisode is for educational and training purposes only and should not be considered as medical advice. Information in My Health Journal is not intended as medical advice. Medical questions should always be directed to a trained healthcare provider.